Dr. J.B. Ketner, Memorial Healthcare Systems here in Seward, Nebraska with another COVID-19 update. Today I want to talk about outpatient management of COVID-19 and specifically I'm going to talk about that first 7 to 10 days after you find out you have a COVID diagnosis. What's kind of the standard of care in terms of treatment? That all drives off the fact that you know you have COVID. So first you got to think about testing. Early on in this pandemic, we really didn't have access to widespread high quality testing. I think everybody's aware of the struggles that we had with testing early on. At least here in Seward, at least right now, we have adequate testing supplies. So if you have reason to suspect that you have COVID, either you have COVID specific symptoms, which I think everybody's heard about, or you have an exposure to someone who you know has COVID, you want to get tested. You want to know whether you have COVID. So I strongly encourage you to contact us. Better to call first so that we can figure out what the best strategy is to get you tested, but there's still good availability of testing. We can turn those results around pretty quickly, so often we know within minutes to hours whether our patient has COVID, and then we can focus on, hey, what are the next steps in managing this COVID infection? So for the purposes of the rest of this discussion, I'm going to presume we're talking about a COVID patient just tested positive, just got symptoms. We know about that. How do we manage that next week to 10 days? It's all about monitoring and monoclonal antibodies. And I'll talk about those two things here. Let's focus first on the monitoring aspects. That first week, there's several key pieces of information we want to know. And I'm going to assume we're probably managing this patient at home. We're in close communication with the patient. I or my nurse are doing virtual visits and phone calls. But there's some really important data that we want to know. One of the biggest of those is what's your oxygen saturation doing? For those that don't know, it's the level of oxygen in your bloodstream, and there are a couple different ways we can find that out. You can purchase a relatively inexpensive home oximeter. It's a little device that goes over the end of your finger, very quickly tells you what your oxygen level is in your bloodstream. You can also download an app to your phone, again, relatively inexpensive or free. It'll tell you what your oxygen level in your bloodstream is, and that's going to be one of those key pieces of information that we're asking about. We want that oxygen level 90% or higher. If it's not, that's probably going to shift our management. We're also talking about, fever, how much shortness of breath are you having, what's your respiratory rate doing. We focus on hydration and nutrition, which can be really challenging given that a lot of folks with COVID lose or have alteration in their sense of taste or smell. Things to support your immune system, like are you getting enough vitamin D, are you getting enough rest? All critically important things. We talk about sleep position, which might sound a little counterintuitive, but COVID patients do better if they don't sleep on their backs, so we focus on things like that. So that's really the monitoring side of that. Again, we're doing that through telehealth visits, phone calls, pretty regular contact with our patients. The other side of that monitoring monoclonals is what are these monoclonal antibodies? Again, early on, we didn't have effective treatments for COVID. Now, on the outpatient basis, we have these monoclonal antibodies, which are lab-derived antibodies specifically directed at the SARS-CoV-2 virus, the virus that causes COVID. So they're given as an infusion here in our facility over about 30 to 60 minutes, and they have been total game changers in the outpatient management of COVID-19. The earlier they're given in the course of the illness, the better the outcomes are. These are given under an emergency use authorization, so it's something you have to talk to your doctor about. Initially, these were just for sort of our highest risk patients, but now that there's more availability, and with this new Delta variant, we're seeing younger and younger patients getting COVID, we've really expanded the pool of folks that have access to these. Again, an infusion given in our facility over 30 to 60 minutes. But again, you have to have a conversation with your physician. So you have to know that you have COVID, and then we determine are you appropriate for monoclonal antibody treatment. Well, why would you want to get these monoclonal antibodies? Our experience has certainly been consistent with nationwide experience, which is if you get patients early on that need these monoclonals and you get them to those patients, you can reduce hospitalization and death by up to 75%. We just don't get that a lot in medicine. So that's why we're excited about it. And I think these probably are underutilized in our toolbox of COVID-19. Our goal is to manage patients outside the hospital if we can. Obviously, if we can't do that, we just keep stepping that therapy up. So that's the whole deal. Find out if you have COVID. The first week is all about monitoring and access to monoclonal antibodies. I want to just touch briefly on a few things that I don't think are helpful during that first 7 to 10 days of COVID. I'm going to talk about hydroxychloroquine. Not a helpful treatment. This has been asked and answered multiple times, as has ivermectin. That's an antiparasitic drug. Useful, we use it in medicine. It's just not effective against COVID. Similarly, antibiotics. Antibiotics are very helpful and we use them all the time, but they are for bacterial infections. They really don't have a role in treating viruses. Early on in COVID, it's all about this virus reproducing itself, and antibiotics don't do anything to help with that, and in fact can in some cases be harmful. So again, get tested. Talk with your physician about that monitoring, and potentially getting monoclonal antibodies makes a difference. So take care of yourself, and if you can, take care of somebody else. Thanks.